Welcome back to the show. Well, this time of year, many of us have difficulties perhaps staying active, getting out, enjoying ourselves, but it is incredibly important to keep in mind you should continue to do that as much as possible. And our next guest is going to give us some great tips and also talk a little bit about postpartum activity. I am joined by Dr. Sarah Bernhardt, chiropractor with Rooted Family Wellness Center. Welcome, Sarah. Great to have you here.
Thanks for having me.
Sarah, let's first talk about the importance of that, because I think, as I said, when the winter months come, sometimes we tend to stay inside and we become less active, but that can have a big impact not only on us physically, but mentally as well.
Yeah, of course. As you just said, I mean, as the months get longer, the days get longer, we're in the dark for a longer period of time, it's that much more important for us to focus on our mental health as well as our physical health in order to get us through those winter months. So whether that's talking to family, friends, to a registered health professional, anything like that can kind of give you the upper hand to push you through our long winter. On top of that, we have our physical health, which is just as important. So again, finding something that you really enjoy doing, that you can stay consistent with, whether that's something small, big, whatever it may be, it just is giving you that extra push again to get you through the winter.
Dr. Bernhardt, when it comes to chiropractic care, I think many of us, and I see a chiropractor, but we tend to do it only when something goes wrong.
Right.
But we really should be looking at it more as a preventative measure as well, shouldn't we?
Well, just looking at the body, pain is kind of our body's last resort. So once we're actually in pain, unless of course it's an acute injury where we fall, break a bone, twist an ankle, something like that. If we're in pain, that usually means that there's a problem that's been going on for a really long time. So that's why maintenance care is so important, is to prevent our body from getting to that point where we actually are in pain, which makes that problem harder to kind of reverse and come back from.
And something I guess you specialize in is postpartum, and the effects, of course, of having a child affects us both physically and mentally. Why did you choose that as sort of a specialty?
I just think it's a specialty that's really lacking. Once we become parents, we kind of lose focus on ourselves and put ourselves on the back burner because we have this new priority in front of us. So I just like to remind people that in order to be the best caretaker you can possibly be, you have to as well make time to prioritize yourself. So again, mental health and physical health, both just as important in that postpartum period, because we want to be there as best as we can for our little ones.
Right, and you offer classes. So what do those classes look like exactly?
So myself, I teach a postpartum fitness class, a postpartum core recovery class, and then I do kids classes as well. We call them fit and fun classes.
Nice.
As well as some prenatal classes as well. So there's options for everyone. We offer virtual, we offer in person, which is great if you're looking for that community of people who are in the same kind of stage of life as you.
Right.
But they're super fun. You can bring baby. We have weights that you can use if you choose not to. So there's really something for everyone.
Well, you've brought baby with you.
Yes.
Right? Why don't we bring baby out here and have a look, because you're going to give us some demonstrations so people at home that, again, have just had a baby, you know, as you said, we tend to stop looking after ourselves and all the concentration is on baby, but you can actually make baby a part of staying active,
with you,
right?
Make them a part of the experience, and they tend to have a blast as well. So I'll show you a couple of exercises that are from our postpartum fitness class.
Okay.
So our first one here is going to be a core exercise. So super simple. We're just going to hold baby in front of us. Again, if we don't have them with us, we can use a weight to replace them as well. And what we're going to do is we're going to do cross knee lifts side to side.
Okay.
So we're engaging the core. We're making sure that the core stays tight because we want to bring baby side to side, knee across opposite side of the body. So that's our first exercise. And again, looks simple, but as you get going and with a weighted baby, you'll feel the burn through the core, definitely. So that's exercise one.
All right.
Our second exercise, same thing. We're going to hold baby close to us.
Okay.
We're going to come into a squat position, and we can modify this in various ways. So we can come down and just hold this position. Again, looks simple, but once we do it for 30 seconds to a minute, we're going to feel that burn through the core. We can also add a little bit of a pulse at the bottom which babies tend to love
I
a
was
little
going
bit
to
of
say,
a
yeah,
bounce.
this is when baby starts enjoying part of the exercise with you as well, right?
Exactly.
What's the response like with babies? Like, are they fairly calm because you're doing all of these movements, and of course you're close to each other, right? Which is important for baby at that time.
They honestly tend to love it. I mean, we do keep our class sizes fairly small, but there's still a lot going on in the room. So one, they're engaged looking at other babies, other people doing movements. So they tend to like that. If they're happy just chilling on the floor, they can have a little snooze. That's why we have the weights as an option. Or if they're a little bit more fussy or they like a little bit of movement, then you're more than welcome to hold them as we do all of the exercises.
So Sarah, is it a mix then of exercise? You know, obviously, you know, baby is your weight in that case, and as you said, if you don't have baby with you, you can use weights, or if baby's more comfortable on the ground and you're using weights. Is there stretching and yoga? I mean, do you focus on all that across the board?
Yep, we also have postpartum yoga, so baby yoga as well. And then we have some Pilates classes as well. So there are different forms of exercises that you can choose. Like I said, the postpartum fitness is more kind of strength and cardio work, but we have tons of options for that more gentle stretching, relaxation work too.
And something unique with C-sections as well, right?
Yes, so I do offer C-section scar release.
Okay.
So this is the tools here that we use for that. So that is basically great for anyone who has gone through a cesarean section, and it's a little bit of stimulation and electrical current that we can put through the scar area.
Oh, I see.
To help release that tightness and release that scar tissue once it builds up after a C-section.
How often do you hold classes, and what's the best way to get in touch with you?
So you can give us a call at Rooted Family Wellness Center, or you can sign up online. We have series running back to back all the time, so within 4 to 6 weeks you should be able to catch the beginning of our next series.
Terrific.
Sure.
Thank you so much, Sarah.
Yeah,
really appreciate
thank
it. Again, you can reach out. You can find them online. It's the Rooted Family Wellness Center. Simply look that up and you can find out their phone number and, of course, their website. We'll be right back after this.